Good morning, everyone. My name is Jessica Chao. I'm the Director of Strategic Planning of Capri. It's our great honor to have all of you here as our panelists. Professor Berse is a member of Capri's International Advisory Council, and Professor Shuhei works closely, Professor Nomura works closely with Capri and have recently published a research report on vaccine hesitancy. You'll be able to find it on our website. And I think both of them have very extensive experiences working with the government on disaster relief, and we'll be able to share insights from a theoretical perspective. And to my right, Chairman of the Silks Hotel Group, Stephen Pan Liang. In fact, the region Taipei is Capri's newest supporter. Thank you. We really appreciate that you share our vision to build an innovative and resilient Asia-Pacific. Stephen, together with Huang to my right, who is from the largest Buddhist charity foundation, will be able to share views from empirical perspective. And let's just go right straight into it. The Sustainable Development Goals, SDGs, were adopted by the UN in 2015 as a universal call to action to end poverty, protect the planet, and ensure that by 2030, all people should enjoy peace and prosperity. And SDG 11 is one of the 17 goals. It is about cities. It is about making cities and human settlements inclusive, safe, resilient, and sustainable. Professor Berse, could you share your view on disaster governance to build sustainable and resilient communities as envisioned in SDG 11?
Okay, thank you, Jessica. It's my honor to be here again, to be back in this beautiful city. First off, let me just say that, the transition towards building resilient and sustainable cities and communities would require really a whole-of-society approach. It cannot be done by just the government. No? But I leave the other parts, the civil society and maybe the academia and the private sector. But I'll talk more about the role of the local governments or local authorities in building resilient communities. And let me just, and this is based on a reflection of many years of disasters that we have experienced in the Philippines, and also learning from the experiences of Japan. And what I came to really is that to be able to transition from being just a reactive society towards a more resilient one would require one word: mindset. We need to change our mindset when we think about disasters. And one of which is maybe to disabuse us with the notion there is such a thing as natural disasters. Because in reality, there's really no such thing as natural disasters. No? It's a natural hazard. Maybe, yes, there are natural hazards that can trigger a disaster. But disasters happen because of our development choices. Many of our governance weaknesses, for example. In the Philippines, you talk about, let's say, weaknesses in building code enforcement. I remember an article some time ago talking about earthquakes, and they said that earthquakes don't really kill, buildings do. No. So in a way, that is for as long as we ensure that we're able to adapt to the natural hazards, then we're able to, Just a case in point, in 2009, there was the big earthquake in New Zealand, magnitude 7.8. So that's about 60 times stronger than what we had last April 3rd. But it didn't turn out to be a disaster because there was no development in the area, zero damage, zero casualty, right? So that's my point, especially in a country like the lower middle income country like the Philippines, where you would have a lot of development issues. Then that's the time when we start thinking about not really maybe, but disasters are not really natural. They're a product of our political, economic, and development choices. That's the point. Now, to be able to do that, once we accept that, then you can start thinking about transitioning or rethinking the way we plan our cities on the part of the local government. And again, that would require, let me just highlight 3 points when it comes to planning. One, we need to start planning for failure. Usually, we're accustomed to planning for success. we have this notion that traditional planning, when we plan, we would succeed. But in disaster risk management, it cannot be all the case. And the reason why we actually have disasters, because our system gets overwhelmed by the event. So there's a failure. So we have to be able to accept and anticipate that failure. And the moment we do that, then you can now start anticipating what kind of additional resources we would need. Maybe from other local authorities or other communities and so on, or maybe from the civil society. The second point has something to do with we need to be able to plan beyond local boundaries or beyond political boundaries, especially at the local level. In the Philippines, all local government units are required to come up with a disaster risk management plan, and it's jurisdictional. But disasters don't respect political boundaries, flooding, earthquakes, typhoons. So there has to be greater inter-local government, inter-city collaboration among our communities. Third point, and the last point I'd like to make, has something to do with the fact that our plans, our disaster risk management plans, should be saleable. They should be marketable to the business community and to the private sector, civil society. Because at the end of the day, no matter how good a local government plan is when it comes to disaster risk management, if the people don't buy it, if the business sector, if it doesn't make business sense, for instance, then nothing will happen out of those plans. That's one, Jessica.
Thank you, Professor Berse. Next question is directed to Professor Nomura. We know you have worked closely with the Japan government post the 2011 Great East Japan earthquake and tsunami. Could you share with us what are the key deficiencies that identified through this incident? Thank you.
Thank you very much. And first of all, I do hope the disaster recovery in Taiwan is going well. You know, Taiwan always supports Japan when we face disasters. I do really appreciate it. And thank you for having me today as well. And so regarding your questions, I want to first clarify the major character of the disaster in Japan. You know, like Taiwan, Japan has a lot of earthquake. But you know, the mortalities from earthquake are not major, not main common. You know, instead, in Japan, the water-related disasters killing more people cause more fatalities, like flood and also landslide due to typhoon or heavy rains, etc. You know, and most of the people who died due to these disasters are older population. So I want to emphasize the critical point in disaster response in Japan are how to evacuate safely older population, especially with disabilities. You know, when the risk of the disaster goes up, a lot of lives can be saved if the families or communities help them evacuate if they cannot evacuate independently, or the local government exactly know where those older people are living somehow. But you know, but it is very, very hard to evacuate older people who are living in nursing homes and care homes. This is a critical issue in Japan's disaster response for now. You know, when there is a risk of disaster, a lot of people needed to evacuate simultaneously. It is sometimes more than 100 people, 150 or more than 200. There are not enough people to support them, and also to support the transportation means, etc. This is a very huge issue. And in this point, you know, the safe transportation is really, really important issue for the older people with disabilities. I know a very important story. When the 2011 earthquake happened, followed by tsunami, you may remember there was a nuclear accident in Japan. And after that, a lot of people evacuated, including people living in nursing homes, etc., in order to avoid a possible radiation exposure. But unfortunately, in some facilities, a lot of people died after evacuation, in particular within 1 month. 1 month, just 1 month. And then 1 month mortality rate was almost tripled, 3 times higher than before the evacuation level. And this is my research. And then I discussed with the facility staff who implemented evacuations regarding the possible mechanism of increased mortality associated with evacuation. And then one of the major reasons was that they did not have enough time to prepare for proper, appropriate transportation means and the vehicle. You know, they had to use general vehicle or the tourism bus for the elderly resident with disability. They did not allow them to lie down. Those people with disability spend most of the time in bed. They are usually bedridden. So the older people with disability in nursing homes did not survive the physical burden of evacuation itself. This is a very, very critical lesson for the Japan's disaster response, which may apply to the Taiwan with similar aging population issue. Thank you.
Thank you, Professor Nomura. Stephen, we know the recent earthquake in Taiwan, Hualien as the epicenter was hit badly. In your hotel, the Silk's Place Taroko has done an amazing job in evacuating its guests. Could you spend a few minutes tell the audience what happened on that day exactly and what your staff have done in the most critical first 36 hours?
Well, the memory is still very fresh. April 3rd, 1758, the earthquake happened. And the most critical thing was we have 500 people trapped in the mountain on our resort at that day. And nobody actually knew about it in the first instance because our communication was down. So we couldn't call for help. And out of the 500 people, we have 350 guests and 200 international guests who's never experienced earthquake, or maybe just a few of them experienced earthquake. And we have 150 staff members. However, all the managers were on the 4 buses that were going up to the mountain at 8 o'clock at that time. So they were there without managers. And our managers, 4 hours later, didn't turn up at a hotel. So apparently they were all trapped in the highways going from Hualien to the hotel. This is a 45-minute drive. So it turned out nobody showed up, and we knew what happened. I mean, we knew they're probably trapped somewhere, but nobody knew what's going on. Yeah. And, well, something remarkable happened. First of all the cell towers, communications were down. So good thing we had a fixed line. That still works. I mean, we applied for satellite communication for 10 years. Never allowed. But we had a fixed line. And the first thing we did, our staff was, for me, was remarkable, is we didn't use it for our own internal communications. We thought about our loved ones, our probably worry. Because our resort was intact, fortunately. So everybody just experienced the earthquake and the aftershocks, but they're well fed, they're okay. And our first protocol is nobody leaves the hotel, nobody checks out. It's like Hotel California. You cannot check out because the hotel is the safest place you want to be at this point. So nobody checks out. We don't leave any. I mean, it kicks in, and then we open up the only fixed lines. It's like 2 minutes for each person to call up their loved ones at home, tell them they're okay. Otherwise, it reminds me, yesterday I was sharing sort of like our college days. You have 2 minutes on a payphone, to call your girlfriend, something like that, or families. And so first lesson is really redundancy. If you don't, especially telecommunication, it's such a connected world. Redundancy. You got to have secondary means. And we have redundancy in energy supply too. We have backup generator. We have our own generator, except we didn't have enough diesel oil. And nobody would, well, anyway, that's a totally different story. But the real story happened on the 50 people trapped in the 4 buses on the way. The first bus was closest to the hotel. And there are 3 mountain climbing staff who volunteer themselves. out of the first bus to try to walk back to the hotel. But what they did was they collected all the other 27 people, passengers, managers, and some guests, their phone numbers and their wills, because they don't know at that time. It's life and death. They don't know whether they're going to make it or not. So they climbed through two floors of rock slides. I mean, they were climbing. It's not walking. A 30-minute walk turned into a 4-hour hike. And they made it to the hotel, actually, by 12 o'clock. And they report everybody's safe, all accounted for. But our other cars are not too lucky. One car was, but then we're lucky in a way that the drivers were local, Aboriginals. So they know how to, here's a lesson. If you happen to be driving and you experience rock slide, drive closer to the mountain. Don't drive to the edge. Because the mountain will show you from the rock slide. Because rock slide doesn't come very quickly. You can hear them, you can see them, and then you can stay close to the mountain. And what they did afterwards, after the earthquake, this is even more important now. Good thing our security managers are all there. So security managers said, let's go. They raced to the nearest tunnel, go to the safest structure. They stayed there. However, one of the cars was unfortunately hit by a rock. And one of the interns had suffered open fracture, which was okay at that time. But 2 days later, after he was rescued, he became unconscious and he passed away, unfortunately. So it is indeed super critical to be able to have people out safely and quickly. Yeah. And what's so remarkable after that is we have 4 teams of extraordinarily experienced rescue workers coming from all over Taiwan. And this is the experience. So I always say resilience is forged by crisis and never waste a crisis. And I recall the 9/21 earthquake 25 years ago in Taiwan changed our building codes. And the SARS, 15 years ago, changed our protocol and everything, resilience, and so that we can deal with the COVID crisis. And so the building codes were ready for disasters. And but I think the most important thing for us is the human experience. Because at that time, when you're all trapped and everybody is panicking, and even the employees suffer the same trauma, and how do you get up and start helping each other? It's that connection and connectivity. If we have time, we can talk about it. But thank you.
Thank you, Chairman Pan. Now turn to Joe. I think we see Tzu Chi in every big disaster sites around the globe. I'm very impressed and very curious as how Tzu Chi mobilized your people so quickly, and then maybe you can use this recent earthquake as an example and tell us how you work locally.
Thank you, Jessica. And it is an honor and pleasure to be here. And just as Chairman Pan mentioned, I think resilience is forged by crisis. And as he also mentioned about the earthquake 25 years ago, I think it was back in 2019, that was the 20th anniversary of the 9/21 earthquake. And at that time, there was a very important initiative by the government, by the education government, in that we wanted everybody in our education system to remember that. Because how is a crisis going to forge our resilience if we don't remember it? I'm sure as Chairman Pan mentioned the story, we all remember what happened to us, to all of us, when on that day, on April 3rd. I was there at the epicenter in Hualien. I remember it vividly. 25 years ago, when the earthquake hit in 9/21 in Taiwan, I was in the United States. I didn't know how big the earthquake was. I never knew that it was that big, but now I will remember for the rest of my life how big April 3rd earthquake was. So in 2019, the 20th anniversary of that earthquake, the government started this initiative to make everybody remember. Because imagine, 20 years, at the time it was 20 years. So can you imagine anybody less than 20 years old? What would they think about disaster? What would they think about earthquake? They would probably think about the major disaster is I will have no internet connection. That's probably what they're going to think about. I cannot go on IG, I cannot go on Facebook. That's what they probably think about. They would not know how big of a disaster it is because we failed to educate them. We failed to let them know. So starting from 2019, we forged this bond with the government on the education of the schools, the teachers, making everybody know what to do. And that's what we do. We have experience as an NGO. We have gone through all these, whether it's domestic or international relief, so we know. And then starting in 2020, we have more partnership with the world because as Mr. Chen here also always helped us with shipping these relief goods to overseas. We realized that during the pandemic that we also need a lot more partners across the world to send all these relief goods. So we started to have these MOUs with different partners, different government, and also private partnership as well. So during that time, it's almost preparing for what's to come. Because on the day of April 3rd, the first phone call we got were from our partners in the local municipal government. They called us because we were in the training together. Our volunteers were their instructors, telling them our experiences in different parts of the world when these disasters happen. We forged very good bonds with these first responders. So then when the government knew that there are going to be these shelters started, we were the first one to call because we're partners, we're in the class together, and they were the instructors. Our volunteers showed up, and they say, oh, Huang 老师你好. They know you because we've been working together. And I think this bond is very important. So coming back to this crisis, forging our resilience, I think very importantly, we have to remember these things. And education is a very important key part of this. And remembering our past and history so that we can go forward.
Thank you so much, Joe. Speaking about taking care of vulnerable groups, I want to go back to Professor Nomura to tell us a bit about evacuating elderlies as the first response and also the longer-term planning.
Thank you very much. So I do think that critical point in disaster response in the aging society is how to long-term care for older people, which is very important. In the aging society, in the population aging, there will be a high demand for not only medical care, but also nursing care. And importantly, the lot of medical disaster assistance team work on medical staff. So there are not enough people for the nursing care. This is the case for Noto earthquake, which happened this year at the beginning. Nursing care is a very important issue in Noto area after a few months later. And also, importantly, nursing care is something that needed for long-term, yearly basis, And a lot of disaster response is all about emergency stages, very, very first stages. So we need to have a system to provide long-term support, including nursing care, a year or 2 years. And then if I could additional point, mental health issue people may have when they are stuck in the evacuation shelters for long term is also a very, very important problem. Thank you.
Thank you, Professor Nomura. And Professor Berse, what about in the Philippines?
Disaster risk management in the Philippines is primarily founded on a principle of subsidiarity, meaning the primary responsibility for responding to and managing disasters are given at the lowest level of government. This is based on the idea that at the end of the day, all disasters are local. When a disaster strikes, the local people, the local communities, the local governments would feel it the most. And so in that particular context, there's this wisdom that maybe you would also be the best people, the best level of governance that could effectively address the situation. So that's why there's been a lot of efforts now looking into building the capacities of local governments in terms of planning, in terms of enforcing different laws and so on, with the notion that, hoping that, At the end of the day, when the disaster strikes, the people themselves, the localities themselves, will be the one who could help themselves. Because, external support may not be able to come in right away. There could be disruption in the transportation system, in communication and so on. So it's important for the local governments, the local communities, to build their own resilience, and that's where I think where education comes in, as mentioned by Chao. The second point is the fact that since 2010, when we have adopted a new law on disaster risk management, we shifted from a response-oriented disaster management to one that is more proactive in nature. So the paradigm shifted from disaster management to disaster risk management. So I think that's an important aspect, because since 2010, and especially after Yolanda in 2013, we have started thinking more seriously about understanding the science of risks, understanding the science of natural hazards, and blending it, merging it with local knowledge. That's the second point I'd like to make. So now we're doing risk assessment and looking at using that as basis for preparedness, for mitigation and prevention, and so on. Of course, it's easier said than done, because the country is like what? It's more than 7,000 islands, and we have actually several thousand LGU, local governments. The third point, I would say, interesting aspect of disaster risk management that we have now is the participation of civil society. As you may know, since after 1986, after the revolution, the civil society space has expanded, has been quite vibrant in the Philippines. And in the area of disaster risk management, we have actually allowed that to grow also. In all of our local governments, for example, we have about 1,720. Each of the local government is required to establish a local disaster risk management council. And in that council, in each council, 4 seats are allocated for NGOs and 1 for private sector. So I think that's kind of an important element that allows for this, at least an official and formal structure for civil society and the government and the private sector to engage together as they plan and coordinate for not only for disaster response, but for pre-disaster planning and coordination. Yeah.
Thank you. Joe, as the Director of Lean Planning for Volunteer Development of Tzu Chi, Tzu Chi is always the first, we see in a lot of incidents, Tzu Chi is always the first to arrive at the disaster scene. Could you share with us on how Tzu Chi train your volunteers?
Yes, thank you. This is always something that we hear, that Tzu Chi volunteers are always the first on the scene, and that is possible because these things are happening locally, as Dr. Berse mentioned, that all disasters are local, and it's happening to the neighborhood. And what the training for the volunteers that we have is to make sure that everybody care. We are conditioned to care for our villages, our families, not only our families, but our villages, our communities, our cities around us, so that we know that we are grateful. And in Chinese, it's called 感恩. What are we grateful for? We're grateful because we are who we are, because the community and the society, the country, has given us this opportunity and the resources to make us succeed. So now it is time that we need to care for it. When this society and community is hurt and it's damaged and it's needed help, we are there to first respond. That's why when all disasters are local, that's why our volunteers are always the first on the scene, because that's their home. And so that's what we do to try to condition our volunteers, not through just the education of the actual, what do you do in the first aid? What do you do when you have to lead the people out of danger zones? What do you do in the first emergency cases? It's not just these technical aspects, but also conditioned to care, conditioned to be more than just connected, be more than just, oh yeah, I know something happened. For example, our international relief work involved not just disaster relief, but also man-made. We have the refugees, whether it's from Ukraine going to Poland, and we have the refugees from Syria going to Jordan and Turkey. We have gone there to make sure that the people of Jordan, the people of Turkey, the people of Poland, that we have established volunteer bases there to care about these things that's happening around them. We are living in a very peaceful society here. We turn on the TV, we see the wars going on, we see disasters going on, but we are conditioned to care more about just what we see on TV, but what more can we do as an individual? That's our education. So not just on the technical part, but also conditioned to have the passion, to drive, to do something more for the people in need. That's our education. Thank you.
Thank you, Joe. Stephen, I read a recent interview published on Business Today talking about, there's one thing really stood out to me, which you said, when hospitality turned into resilience, soft power will become hard power. And with that, I would like you to share your take on resilience in the situation of disaster and summarize our panel.
I think we all have a lot to learn with Tzu Chi, and indeed, community is the key. During the most recent earthquake that we had, our resort actually also brought in, took care of over 100 hikers and local villagers. And we became the disaster relief center for the whole, the Taroko National Park. And over the years, actually, even during the COVID, I think it's very important when we supported the community. We actually, during COVID, we laid off tour guides to give us lessons on local culture. And so throughout I think the resilience should be built or can be built into everything we do. It's in our DNA. And our DNA is really is anchored by a golden rule: treat the others the same way we wish to be treated. So when it happened, everybody rose up, and I felt that, everybody was traumatized, and we focus. You talk about mental. This is really the key. Actually, things can get very chaotic and unmanageable when people lost touch with the outside world, when the communication is down. It's probably more cause for disaster than the disaster itself. Yeah. So human connection is really the key in times like this. And I can share experience. Our emergency response team is directed to every stakeholder, to the guests, but also to the employees, and also for their loved ones, for the disaster response team, local government, and also to the media, communications. So I cannot say I was joking, but because our general managers was in Taipei, our managers were trapped in a row, and then later evacuated to Hualien, and most of our people were in the mountains. But also because we are separated in three different ways. So our Taipei office was calling every guest's family and every staff's family to let them know they're okay. They're safe in the hotel. And this is very important. So I feel, and that becomes power to recover, power to learn, and power for resilience. That's how I felt when the power of hospitality, something so soft, can build lasting resilience. Thank you.
Thank you so much, Stephen. And with that, thank you. Thank you for participating in our panel. Thank you. And thank you. Please remain a seat.
Thank you. Please put your hands together to thank our panelists and also our moderator for this very fruitful discussion.